welcome to Autoimmunity.in. We are a community for people with autoimmune illnesses to connect, to, um, to connect with each other, to share stories, and to inspire each other through their journey of their life. This is a series called Autoimmunity and You, where we invite expert doctors to simplify different autoimmune illnesses for us. Today, we will be discussing Myasthenia Gravis. We have with us a new face today, Dr. Siddharth Warrier. Dr. Siddharth Warrier is a Mumbai-based neurologist. He studied medicine in Grant Medical College, Mumbai, and holds an MD degree from Seth GS and KEM Hospital, Mumbai. He completed his DM neurology course in SGPGI Hospital, Lucknow. He is currently practicing at Wokhart Hospital at Mira Road and at Chole Hospital, Nala Sopara. He is also a poet and a YouTuber. He has co-founded the Poetry Club Lucknow, one of our first poetry groups in the city. He has performed at various literature festivals and cultural events across the country, such as the Kala Ghoda Festival in Mumbai, all of us know about that one, and Lucknow Literature Festival. His poem Limbic Love has been awarded the International Hippocrates Medical Poetry Award in 2019. In his YouTube channel, he explores neuroscience and learning. Apart from the fact that he's also dealing with autoimmune illnesses every single day, and he's the best person to simplify this for us. Hi, Dr. Siddharth Warrior.
Hi, Neetu. Thank you for having me here.
Good to have you with us, an autoimmunity expert. Thank you. We're very grateful that you sparing your valuable time and simplifying this illness for us. Let's get started by getting to know a bit about you. I mean, I've given an appropriate introduction, but do you want to tell us a little bit about yourself as well?
So I think that the description that you just read out kind of summed up my life, but there is a couple of things that I wanted to add was that the whole journey in medicine and balancing it with poetry has sort of made me realize how difficult it is to do two things at once. And it makes me aware of the kind of challenges that people with illnesses would be going through.
Yes.
Because for them, almost everything is an act of balancing two things. Because whatever else they want to do, they have to balance their illness alongside it.
Absolutely.
So in a very essential way, it is multitasking. So I think every single day is a multitasking challenge.
Yes.
So I think I've started appreciating that. So anything I can do to help would be great.
Super, super.
Yeah.
So digging right into this, can you tell us what, according to you, is autoimmunity?
So in a very simple sense, your body has a system that is dedicated to fighting bad guys. Yeah. So any infection that comes from the outside, any bacteria, any viruses, they come into your body, you need to have a system to fight it. So that is called as the immune system. Yes. And the immune system has all these cells that are really specialized in killing outside bad guys. Mm. The problem happens when that immune system gets confused and doesn't realize if a particular cell is an outside bad guy or one of your own good guys. And so if it gets confused, it might start killing your own cells and attacking your own cells.
Right.
That is called as autoimmunity. So when your own immune system attacks yourself, that is autoimmunity.
Right. Getting right into it, what is this illness that we're discussing, and why is it one of the more pervasive in India? How many patients do you know that you've dealt with? Could you tell us a little bit about this?
Sure. So Myasthenia Gravis is a disease that affects a very particular part of your body. So there is something called as the neuromuscular junction.
Right.
So by the word itself, what it means is that you have nerves in your body and those nerves end up in muscles. So that is how you move. So when you say you want to move your hand, the command comes from your brain all the way down through nerves and ends up in a muscle, and that muscle will act. Now, at the end of the nerve, before the muscle, there is a space, which is called as the neuromuscular junction. So the space between the nerve and the muscle. And the signal has to cross from the nerve to the muscle, saying that you have to move now.
Right.
If there is a problem in that junction, something that prevents that signal from jumping from the nerve to the muscle, that muscle will never know that there is a signal to move. And so even when you try to move your hand, you will not be able to move your hand. So then that will come across as weakness.
Right.
And so the reason myasthenia gravis is important is because it is an important cause of weakness. The person who is suffering from myasthenia gravis will feel tired and will feel unable to move. And one of the important things in myasthenia gravis is that different muscles can get involved. So if your hand muscles are involved, then you won't be able to lift your hand. But what if your lung muscles are involved? What if your diaphragm is involved? So then you will have trouble breathing. If your eye muscles are involved, you will have trouble opening your eyes. So this is the problem. So then myasthenia gravis can be a dangerous disease.
Um,
Yeah.
Thank you for simplifying that for us.
Yeah.
It's kind of puts everything into a great perspective. Uh, so, as someone who's either a caregiver or someone who knows someone with this illness, how do I commonly differentiate this between a stroke and a paralysis attack, and myasthenia gravis? What is the difference? Is there a commonality? Is there a difference? Could you tell us a little bit about that?
Sure. So when we talk about autoimmune disorders, uh, I would like to just draw a parallel with another autoimmune disorder called as multiple sclerosis, which is called as MS.
MS.
Okay. And when you say stroke, one of the uh, close differential diagnosis of stroke is multiple sclerosis. Usually, myasthenia gravis will not be mistaken for a stroke uh, because myasthenia gravis will come as a generalized weakness.
Okay.
So it is not likely that myasthenia gravis will come with just on one side.
One side.
Whereas usually stroke is on one side because one half of your brain is involved.
Right.
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 So in a stroke, the traditional terminology of stroke is applied when there is a blood clot in any of your blood vessels.
Which
So one
is
side blood vessel gets clotted. So
Mm.
there is weakness on the other side. And multiple sclerosis can also present like that.
Mm.
If there is a damage to one part of your brain, then the other part, the side of your body can get weakness. But myasthenia is because it is a generalized problem. Usually it is on both sides, and usually it is not mistaken for stroke. It can get mistaken for other things. It can get mistaken for just tiredness. It can get, it can present as generalized fatigue and all those other things. But yeah, there is a fundamental difference there.
Fundamental difference. So, I understand that myasthenia gravis affects the motor movements of a person. But does this mean that it limits the movements, or it completely stops the particular organ or the muscle from functioning?
So it depends on the severity of the problem. So a mild case of myasthenia gravis may not present with complete weakness. So initially what happens is that there will be a fluctuating weakness. And this is one of the main characteristics of myasthenia, in that the person will feel that in the morning, they are quite okay. They don't feel so bad. And then as the day progresses, gradually their weakness is increasing. And by evening, their eyes are shutting down. They're not able to lift their hands. And again, in the next day morning, they are again better. So this fluctuating course is one characteristic of myasthenia gravis. And of course, like in any disease, there is a severe form in which they are unable to move any of their hands, legs, or they're unable to breathe, they're unable to talk, they're unable to swallow. So obviously that is a crisis. So they need urgent treatment for that.
So, what kind of symptoms do the myasthenia gravis patients right in the beginning, what kind of symptoms can they look out for, or can a person think that they should probably go to, not their GP immediately and get this sort of examined a little more.
Sure.
Because culturally, we're the kind of people saying, it's only this, it's only that, and we don't really worry about it. But there can be a deep rooted ailment or condition that needs to be evaluated a little more. So, what are the common symptoms? Apart from the ones that you just mentioned, which are clear indicators once a person is diagnosed, and that's what
Right.
they live with, that's what they live with completely through their life. But
Right.
common symptoms.
So the clear cut symptoms, unfortunately, what happens is that before it becomes very clear cut, there
Right.
is a long range where of time where it is not clear. And not just for the patient, sometimes it's difficult even for a doctor to pick up myasthenia gravis because it is very subtle. And like you said, we do tend to dismiss some things just thinking that, okay, I just had a late night, maybe I'm not eating well, that's why I'm tired. And it's difficult to say that everyone who feels tired at some point should get a myasthenia gravis test, because that's not the message here.
Right.
But definitely you should be aware that if you are getting specific things, like if your eyes are shutting down, if your eyes are closing up more towards the evening, and then in the morning you're able to open them properly, or if in the
And this
evening
is
you are unable to
involuntary.
lift your hands.
Yeah, this is
Pardon?
involuntary, meaning that it's
Yeah,
doing it on its own. It's not like, you've hurt yourself, or there is some other reason which you can sort of,
correct.
this is happening on its own. For example,
On its own.
dripping of the eye, which is, something that it's just happening on its own. That's one clear indication.
Yeah. So that's called as ptosis. So PTOSIS. So that's called ptosis. And if there is a fluctuating ptosis, so if your eyes are shutting down in the evening and you have trouble opening them, or if you have trouble, say, swallowing, so
Mhm.
some that is called as bulbar myasthenia. So if you have trouble swallowing or speaking, or when
Right.
you're drinking water and it tends to come out through your nose again and again, that is a very, very clear sign that you do need to go for, a consultant.
Okay. So,
Yeah.
does myasthenia gravis involve inflammation? Because while we're doing this across different autoimmune illnesses, there is a common thread that I'm noticing, that there is inflammation, or there are these certain common threads. Does it have inflammation? Does it involve that in the body? Pain, inflammation.
Right. So inflammation in the traditional sense, there are some autoimmune disorders that have a lot more of inflammation.
Absolutely.
And in myasthenia, there is less of inflammation. That doesn't mean there isn't, but there is less because it is a very targeted disease.
Right.
So it is not like the inflammation is just spreading all over the body, like in other diseases like lupus, for
Yes.
example.
Yes.
Whereas in myasthenia, the target of your autoimmunity is very specific. And so only that particular molecule is getting affected. So there is no generalized inflammation, but the same medicines that you would use for generalized inflammation is effective in myasthenia. So you can't say that there is no inflammation because the anti-inflammatory medicines do work,
Yes.
but there's no generalized inflammation. So it's kind of in the middle.
It's can be.
Yeah.
A common symptom, another common symptom that while I was doing a little bit of reading about myasthenia gravis, is blurred vision, multiple vision, which is what you mentioned earlier. So, uh, while one is getting that, one typically tends to go to the eye doctor and figure out. So
Sure.
here we're noticing that there are so many other people that we or other doctors or experts that we go to before we actually arrive at the final diagnosis,
Yeah.
of say myasthenia gravis. Is there a particular age group, or is there a particular sort of typical patient type that gets identified, is more exposed to getting myasthenia gravis?
Right. So in general, autoimmune disorders tend to be more common in women,
Yes.
and the age group is slightly younger women, so around 20, 30. So that is the age group where autoimmunity tends to present itself.
Yes.
And of course, men can also get it, but it's a little less common. And men tend to get it more at a higher age group. So around 50, 60,
Yes.
there men tend to get it more than women. Whereas in the younger crowd, women tend to get it a little more often. This is not, I mean, as good as this is for an epidemiological understanding, so an overview,
Yes.
but in a specific patient, you can't use this knowledge because it can happen in both genders. So
Absolutely.
if somebody is getting this problem, you can't say, oh, I'm a man, so that's why I won't be getting this. It's absolutely not
Absolutely.
like that.
Yeah.
Men can also get it. Yeah,
So just like Corona, it doesn't discriminate between the female gender and the male gender. Um,
correct.
so in India, equally, men and women are equally exposed. There cannot be sort of a discrimination, but more commonly seen in the younger group of women and the older
Yeah,
group of men. Okay.
sort of,
So,
yes.
so what happens to a patient once? Uh, Before we get to that, maybe what kind of tests do they need to go through before, and how complicated are these tests for them to identify myasthenia gravis?
So the first thing that has to be done is you have to suspect it. So the doctor has to think of this
Absolutely,
could be myasthenia, because if
absolutely,
that doesn't happen, then nothing else will
that's
happen.
correct.
And
Absolutely,
as soon as you suspect it, then you start looking out for it. The tests themselves are not complicated. There are a couple of bedside tests that you can do. There are a couple of medicines that you can give and see the response.
Mhm.
And there is a test called as repeated nerve stimulation test. So it's called RNST. And basically what it does is it just gives some electric signals to one of the nerves, and it sees how the muscle reacts. And so between the nerve and the muscle, as I said, there's a neuromuscular junction.
Right.
So this test will be able to see if there is any problem in that connection.
Mhm.
And there are some blood tests that you can do. So not complicated. The test should get done within a couple of days. The results should be back in 2, 3 days. The important thing is to suspect it.
Right. So while we're talking about being able to suspect it, um, what is your observation as far as patients or people that eventually come to you and get diagnosed with myasthenia gravis? What is your observation? How much time does it typically take? Because again, the root of this question is because I've come across patients that say this is a difficult illness to diagnose. There are many
Yeah.
confusing symptoms. Does it take a really long time typically in our country for somebody to come down to this? Not only because the illness is complicated, but because you're going through so many steps, or does it
Right.
sort of, yeah,
It's a so both of those factors are valid, because the symptoms are can be vague.
yes,
It can get missed for multiple reasons. The patients themselves may not come thinking that this is because of something else.
mhm,
If they do visit a doctor, and if that doctor hasn't had experience with myasthenia before, then it wouldn't strike,
right,
and they may continue treating the symptoms, the weakness. So they will give them something for the weakness, and the diagnosis may not be made clear.
mhm,
uh, Usually it would, when this patient lands up at a neurologist's office,
mm,
that is when the diagnosis is made,
mm,
or a physician's office, that is when the
yeah,
diagnosis is made.
yeah,
So what you're asking is basically how much time does it take for a patient to go to a doctor, and how much time does it take for that doctor to refer the patient to a neurologist. So
yeah.
this is a very, very variable question, but uh, it can go from days to years, depending
Absolutely.
on the severity. So if a patient is having a severe illness, it is actually more likely that they will end up with a neurologist quicker.
Pick up, right.
Right.
So there is the sad part where for years a person could be struggling to figure out what this illness is, and probably be taking very simple medicines instead of the actual ones that could really help them early on, which is the reason why we're doing this actually, so that people are able just know that there is something like this, and
Right.
even if they ask the right question to their general physician and say, can I, could it be this? Sometimes
Right.
even a little question like that can sort of make all the difference, and get them to the neurologist faster, because the earlier
Sure.
that this is treated, I presume that there would be a great difference between maybe 2 years down the line,
Absolutely.
starting medicines at that point. So
Absolutely.
how expensive are these medicines, and what form are these medicines? Again, is it a steroid based therapy? A lot of patients have this myth that taking steroids, and it's very scary, it can do a lot of bad things to me, and I don't want to take this drug. So could you share a little bit of information on that?
Sure. So in all autoimmune disorders, steroids play a role
Yes.
because the basic function of steroids in this disorder is to control inflammation, reduce inflammation.
Right.
So it does play a role, and especially in the acute stage, so in the initial stage. And there are other, because we don't want to give steroids for a long time, there is a whole section of drugs which are called as steroid sparing agents. So the whole purpose of giving those medicines is so that we can spare giving steroids. Now, those drugs will have their own side effects. Unfortunately, in the way things are, side effects is something that you cannot escape.
Absolutely.
The whole point is that you have to be able to balance the risk and the benefit. So you have to know, why are we giving this? What is the purpose of giving it? And what will happen if we don't give it?
Mm.
And versus what will happen if we give it. And it is literally, we have to balance the two and say that if we don't give it, the outcome will be much worse. And
Yeah.
once we are clear on that, then there is a moral and ethical justification for giving the drug.
Yes. So I've come across patients as well as doctors that say that we don't want to give the steroids to our patients, and we
Sure.
always aim that we look at something that works better for them, but we resort to steroids to maybe help us control the situation initially, and then our end objective or is to reduce the level of steroids that a person is
Yes.
taking.
Yes.
So one
Yes.
doesn't really need to fear, because once you're on steroid, it doesn't mean that you're taking it for life.
Of course.
Yes. So I am an autoimmune hemolytic anemia patient. Unfortunately, I have been taking steroids for a very long time, and which is the fear that most patients have when they are
Yeah.
diagnosed with an autoimmune illness. Is myasthenia gravis hereditary? Can a family member pass it on to their um, to their children? And do siblings need to worry if there is a family member that's diagnosed?
So there are diseases where you can say that this is absolutely hereditary. So there are diseases where if somebody in your family has it, then you need to get tested, or you might think of getting tested. In myasthenia, it is not like that.
Okay.
Genetics play a role, but it is not that if somebody in your family has myasthenia, then you will have myasthenia. It's not like that. It is a multifactorial thing. So it is not that one gene, if you have this gene, then you will get it.
Yes, unlike
There
other
are
chronic illnesses that we know. Yeah.
exactly. So there are diseases like Huntington's, and so there are diseases like that, that it is one gene, one defect, and you can actually study that and you can test it. In myasthenia, there is nothing like that, but there is a group of genes that come together to increase the risk of you getting it. And what is interesting is that sometimes all these autoimmune disorders travel together. So if you have myasthenia, then you can have some other autoimmune disorders as well, because those genes control not just myasthenia, they control immunity itself.
Yes.
Right. So then you can get some thyroid problem, you can get diabetes, celiac disease. So these are all diseases that go together. Technically, theoretically, they can go together.
Yes.
So that is something to remember.
Right. But does that mean that if I've been diagnosed with one, I'm most likely to get another one? Does that?
The doctor has to think of that
Yes.
and
One has to
remember
look out
that.
for
So
it.
correct. So this fear is not something that we push onto the patient.
Absolutely.
Rather, this is a responsibility the doctor has to take to check for the others.
Check for the other.
Correct.
Right.
Right.
So it's like a part, people are sort of what is that term? You sort of you get into a wedding party, you crash a wedding party. So this is like crashing into a person's body,
Yeah.
uninvited.
Uninvited crashes, correct.
Uninvited party poopers, or people who crash into the party.
Right. Right.
We've sort of touched this topic now. We've talked about treatments. So we said that steroid, non-steroid treatments. Are these treatments very expensive in India for myasthenia gravis?
There is a whole spectrum. So steroids themselves are not expensive.
Yeah.
Steroid sparing agents, they can go from non-expensive to very expensive. So there are these new drugs called as biologicals, and the longer term is monoclonal antibodies. And this is something that has recently come up. It has more efficacy. It has like a greater effect, but it's also expensive. Can go up to anywhere from few lakhs a month uh, to much more actually.
Yes.
And the other end of the spectrum, steroids themselves not very expensive,
Yes.
1,000 a month. Putting together with some other steroid sparing agents, there are steroid sparing agents also which have a range. So there is a lot of room for discussion here.
Yes.
So it is not that if you get this disease, you will go bankrupt.
Yes.
It doesn't have to be like that, provided that it is diagnosed in time and controlled in time.
Yes.
Because if there is a crisis and the crisis is what will actually be financially draining, because that would need an admission, an ICU admission, ventilator, that whole thing. So what the cost of early diagnosis and treatment is much lesser than a late diagnosis and trying to play catch up.
Right.
Right.
Yes, absolutely. That is exactly what I wanted to sort of bring out over here. Again, with personal experience, the day-to-day management drugs that I'm taking for my illness are negligible. They do not drain me financially. But the moment that I have a flare and things get out of hand, which they quickly do, then it's back into the hospital, and then you're not even supposed to look at the bill. It sort of shoots up, and
it shoots up.
yes, it
Correct.
shoots up.
So
And
the prevention is better than cure, and prevention is cheaper than cure. I mean, I think autoimmune diseases really highlight that.
yes, yes, and so the huge importance on being able to diagnose it early on,
Absolutely.
and managing it rather than sort of crossing the bridge when there's all fire.
Absolutely.
So patients today are very aware of autoimmune or immunity because of corona.
Sure.
And everybody's sort of woken up to the whole concept of what immunity is. Does a myasthenia gravis patient, is he more exposed to corona? Should he fear this pandemic more than a regular guy?
Yes, because it's not that they are more exposed. Everybody is equally exposed, and the chances of you getting an infection are also, as far as the studies have shown so far, we don't know if a myasthenia patient is more likely to get corona given the same level of exposure. But the danger comes when an infection acts as a trigger for a myasthenic crisis. So in a myasthenia patient, one of the most unfortunate things is that they could be absolutely normal. They've been diagnosed, they're taking medication, they're absolutely okay, and they get an infection. That infection could be a urinary infection, or a lung infection, a stomach infection. That infection throws their balance off.
Absolutely. And then it's
yes, and then you go into a cascade, and before you know it, you are in a crisis.
Yes.
And this can happen with any immune disease.
Absolutely, yeah.
Including, hemolytic anemia and lupus and all immune disorders. In myasthenia, it is dangerous because that crisis can lead to you having a respiratory problem, so a breathing problem. So in that sense, they have to be careful about corona even more, because corona also affects the lungs.
Affects the lungs, yes.
And myasthenia also gives you trouble breathing. So put those two things together and it's a very dangerous combination.
So this is probably the first illness and that I'm um, detailing or discussing where corona seems to be playing a large role. As autoimmune patients, I think we learn to live with being, you know, overly concerned about hygiene, food. We generally tend to get into a lifestyle where we're very, very careful about where we travel,
Right.
using public toilets, you know, to avoid infections, eating only cooked food so that we avoid infections. So we're essentially trying to keep the infection so far away from us. That's essentially,
Right.
you know, the rule of the game. But in this case, because the infection is in the, you know, so easily passed on, and the virus,
Yeah.
that's what makes it more scary. Wow. So we've talked about what myasthenia gravis is and how it can negatively impact us. Let's get to the good part. Once a person is diagnosed, what can he do to manage this illness better? Are there foods that he can take? Is there an exercise regime that he can get into to manage the illness better? I understand that everybody
Mm.
talks about exercise is good, yoga is good, healthy eating is good. We know that. But typically, for a myasthenia gravis patient, how important is exercise, a change in diet and lifestyle,
Yeah.
and what can he do to manage this illness better?
Correct. It's a good question. There is there are two things to think about here. One is preventing a trigger, preventing a crisis. So your diet as a way to prevent the crisis. So you make sure that you're eating healthy and more importantly, not eating unhealthy.
Yeah.
And that way, you know that your basic uh, reserve is good. Another thing is that you can use, and also I mentioned how celiac disease can sometimes be a part of that whole spectrum of immune disease. And one of the things in celiac disease is that it gets triggered by diet. So if you
Yes.
have gluten diet, then celiac disease can get triggered. And if both of those things are coexisting, then you need to make sure that you are on a gluten-free diet,
Gluten-free diet. Yes.
right? And in general, the role of exercise is to increase your reserve. So think of it as a football team. So the team might be good, but if you don't have good substitutes, and if
Mm.
somebody gets injured, you need a good reserve to come on and play. Similarly, you might be doing all right on your everyday life, but then when you have a crisis, the more lung reserve you have, the more your lungs are able to handle stress, the better the outcome. Which is why if you do yoga and if you do exercise and if you do have a good lung reserve and a good physical immune reserve, then your body is able to handle that stress much more. So this won't make a difference for your everyday life, may not, but in a crisis, that reserve will be very, very useful. So for that, it is good to exercise early before you need it. So it is always good to keep things pehle se hi,
Yeah.
so it is good to start that routine of regular exercise and regular yoga and good diet regimen. Yeah.
Right. So, as one would advise a regular individual to stay healthy, eat healthy, maintain a
Yeah.
regular lifestyle of maybe improve exercise to avoid other illnesses and other, you know, like back issues, neck problems, which we get from work from home situations today. All of us are dealing with these lifestyle diseases,
Right.
we call them. So, what I understand is if your body is well tuned, you're constantly being mobile. You're kind of helping yourself be stronger during a crisis. That's about all.
For sure.
So
For
you
sure.
mentioned gluten. Now there is this whole discussion about gluten in general in with autoimmune illnesses. But does
Yeah.
gluten it affects something like celiac disease uh, directly? Because
Yeah.
celiac is all about, you know, how the body tolerates the food, etc.
Correct.
Um, how important is it in myasthenia gravis?
So
I
the
mean,
truth is
typically
we
only
don't.
for this illness. Only for this illness.
Yeah. So we don't know.
Okay.
There have been a lot of studies. The ones that I have read. There is definitely a strong connection between the gut and the immune system. There is no doubt about that. The gut plays a big role in how your body handles immunity, and the gut also plays a big role in how these triggers happen. But we are still discovering, we are still learning, we still don't know which foods will do what. There are a lot of theories on how there are certain foods which are pro-inflammatory and there are certain foods which are anti-inflammatory.
Yes.
uh, Probably the most honest thing to say is that because it is not my core area of expertise, I'm not sure exactly. So what I tend to do is I tend to involve a dietitian,
Yes.
and because I would refer to their knowledge, and they will guide all my patients. So I do tend to involve a dietitian in all my immune disorder patients,
Right.
and I found that it does help.
Okay. Yeah.
Yeah,
So what I was trying to do was, because wherever you start reading, you start googling, you see this paleo diet, this diet, that diet, and everybody's telling you
sure.
what to do, and you keep reading about these things, and then you try and implement it, and you don't even know whether it's the right thing for you. Um,
Right.
and you're sort of shooting in the dark. So the best thing to do is ask your doctor, or ask a dietitian, and they will sort of guide you to the right place. And there'll
Correct.
be a proper, certified regime of food that you should eat, shouldn't eat, do, not
Yeah.
do, and sort of seek the guidance instead of doing like this self therapy that
Yeah.
may work for you, may not work for you. Sometimes it actually works against you.
Correct.
Yeah.
Yeah, and diet is a hugely important factor, and it
Yeah.
is a specialty in itself. So I think that a lot of doctors also realize this, and uh, for them to really know what to advise and what to not, it would actually take a lot of studying and learning,
Right.
and because there is a reason why different specialties have come,
Absolutely. Yeah.
because there is so much information available in each field that it is not always possible, but we should have an idea, and we should definitely involve other specialities in this,
Yes.
especially in a case like autoimmune disease where almost every system gets involved.
Yes. We tend to have this impression that once we've gone to a general physician, and then we get worried because they refer us to a specialist. And if a
Yeah,
specialist further refers us to a super specialist, then we get further anxious. But that doesn't necessarily mean that, it's all downhill. It's essentially that we're trying to get to the core problem. We're trying to identify
exactly.
the core issue. And the moment we identify the core issue, if it is an autoimmune illness, there are specific medicines, specific things, specific tests, specific drugs, and this only can come from the whole specialist and the expert that we, and
Absolutely.
one of whom we're talking today. So I think we've sort of covered everything
Yeah.
that we wanted to understand the illness. Is there anything that you'd like to leave behind for us, for a Myasthenia Gravis patient? Sort of
I
like,
just yeah, I just wanted to give you a little bit of positive uh, like a summary that if it is diagnosed properly in time
yes,
and medications are taken in time, I have seen myasthenia patients living a normal life,
absolutely.
and that is very good to see, because that is the end goal. Unfortunately, science has still not reached a place where we can completely prevent illnesses like this. Maybe in the next 50 years, maybe we can be able to, but today in 2020, this is the way things are. So right now, because of all the advances that have been made, people are able to live a close to normal life. So definitely, it's not that it is all lost hope. So there is a lot of things that can be done, but it needs to be done. That's the important thing.
Right. Which
Yeah.
brings me to my final question. At autoimmunity.in, we're trying to build a community of people to come together and be able to talk about such illnesses. First and foremost, to be able to accept, and the illness is a part of their life, like a best friend who's going to be around always. And best friends are supposed to be positive; they're supposed to positively affect you.
Yeah.
And we're trying to build this community, and we're encouraging people to talk about this illness. My final question is, how important is it for an autoimmune patient to be part of this kind of a peer support group or an online community or whatever format of positivity that they can bring into their life with a group of people?
Sure.
How
Yeah.
important is that?
Very important because they are going for the first time in their lives, they are going through experiences that, uh, to be very honest, nobody around them really gets.
Absolutely.
And
Absolutely.
as much as people may empathize and sympathize and give moral support, it's very different to talk to somebody who's going through the same thing.
Absolutely.
And there will be a lot of, especially if somebody has been going through it for the last 5 years or 10 years, and if you've just been diagnosed, there will be a lot of questions in your mind that your doctor may not answer, but somebody who's been going through this for the last 10 years will be able to answer. So I think that it is hugely important, and I think it's amazing what you're trying to do, and all the best to you. I think it's a great initiative.
Thank you very much. The motivation behind autoimmunity.in is because I've had a fairly lonely journey in the last 20
Yeah,
years
yeah,
with autoimmune hemolytic anemia. I've yet to meet another patient who has it.
yeah,
Um, and I believe that if people, there's a common thread across autoimmune illnesses, be it medicines, doctors, the kind of lifestyle changes that you need to adapt. And as you very rightly said, family and friends can be a great support, but they can never truly know what you're going through because these illnesses are inside you. It's not like, it's a disability, you've lost a hand and one can see that there is a limiting factor and be able to help you through it. This
yeah,
is inside your body. Sometimes you will look at a person and not even know. People look at me and say they think there's a fairly healthy, on the slightly heavier side, there's a woman, she's absolutely fine. They will not understand that I'm getting breathless,
right,
that I'm having
right,
chronic fatigue, or that I'm just
yeah,
having bad days. A few days in the week are really
sure,
bad days or in the month. So
sure.
thank you very much for
So
simplifying.
family, the idea of uh, empathy and moral support. So it's they all have their own very special role to play.
Absolutely.
So
Yeah.
so this, a community cannot replace a family, and a family cannot replace a community. So it's really important to have both kinds of moral support. So
Yes.
yeah, I think that's
So the other day I spoke to a lupus patient, and she was diagnosed when she was really young, and her mom
hmm
has been her crusader through and through because she's a fairly young child, and today she's
yeah,
absolutely out of it, and she's living a full, healthy, excellent life. She looks forward to
yeah,
being a doctor, and she wants to be a doctor because she got inspired through her experience, and her mom's
amazing,
been her crusader throughout. But she's joined our community because she understands, one, that she will be able to share, an inspirational story of hers,
sure,
and then be able
sure,
to tell people it's okay. You can still have a beautiful life. A
absolutely,
parting thought that I have is that you can get this illness, but don't let it define you.
hmm
It can be a part of you. It's not going to go away, but you can absolutely learn to live a fulfilling life with any autoimmune illness that you have. Thank you for sparing your time today, Dr. Siddharth. Um,
me too.
it's been amazing talking to you and sort of understanding this better. Uh, I hope we can do this again in the near future pretty soon and speak of
Sure,
another illness and simplify it. Thank you very much for your time.
thank you for having me.
Bye bye.